Currently, human biomonitoring, shortly HBM, is extensively implemented at the global, multi-country and national levels. Motivations to implement HBM surveys are several and include recommendations of the World Health Organization, the International Programme on Chemical Safety, and the European Environment and Health Action Plan. Lately, also the Minamata Convention on Mercury also bases its effectiveness evaluation on HBM practices. The most common reason for initiating a national survey is the absence of data on general exposure to toxic chemicals originating from environment or food consumed. It is therefore not surprising that in most cases the immediate objectives include the determination and identification of chemicals found in human bodies. Investigation of exposure factors and determining reference values for different population groups is also a common goal. Monitoring the number of people with levels of chemicals above known toxicity is also very important for immediate action. Assessment of geographical differences and temporal trends and identification of highly exposed subgroups is also important to guide public health campaigns. Future trends in HBM programs are directed towards more ambitious goals, such as supporting the establishment of health-based guidance value and the use of biomarkers of effects and sensitivity to protect most vulnerable and highly exposed populations. In selected countries where HBM programs are legally endorsed, system is set up to use the HBM data to support risk assessment and policy decisions for risk reduction measures and evaluation of their effectiveness. Such measures also include communication of risks and protective measures. Although some countries are advanced in HBM, a common challenge to all HBM programs is to secure comparability of the study results. Therefore, activities implemented by the World Health Organization and initiatives implemented in the framework of EU projects such as COFES, Demo-COFES, HBM for Europe, and currently ongoing PARC have been timely and relevant for the improvement of national HBM programs in Europe and wider. In addition, the role of international organizations, especially the World Health Organization, in promoting HBM worldwide is very important. Comparable data are obtained through well-prepared training materials and pilot studies conducting using harmonized protocols. Providing science-based knowledge about chemicals and effective communication and prevention measures help build national human resources that support risk assessment and risk reduction at global, regional, and national level. Some of the regional programs, such as the Arctic Monitoring and Assessment Program, shortly AMAP, has long experience and are in many ways advanced, especially in terms of linking HBM and health effects. AMAP advises the governments of the 8 Arctic countries on matters related to threats to the Arctic region from chemical pollution. For this purpose, HBM specifically covers persistent organic pollutants and chemicals of emerging concern for Arctic, as well as toxic metals with focus on mercury. In conclusion, the more countries establish national HBM programs using a coordinated approach, the closer we will be to the goal of the HBM, and that is to guide risk reduction measures based on HBM results.